This is Stan Goff, the editor-in-chief of Dental Products Report. And dental implants is a very big topic, and today we are honored to have Dr. Russell Nishimura. He is the president of the Academy of Osseointegration, and he's going to talk a little bit about implants in general. We're also going to touch on the fact that we had a cover story in May that was pretty well received, but we want him to, it's such a big, important topic that he's going to elaborate and touch on some of the trends. Hi, Doctor.
Hi, thank you for having me.
And you know what? We were hoping to talk about 4 key trends and maybe a few other things. But first, why don't you tell the viewers a little bit about yourself?
Well, I'm a retired professor emeritus from the UCLA School of Dentistry, where I practiced implants from the very beginning when they first came to UCLA in the West Coast. And then I took early retirement, and I'm in private practice in Westlake Village, California. And I'm currently the president of the Academy of Osseointegration.
Gotcha. And I imagine implants have gotten a little bit better since you first started getting involved with them.
It's been a dramatic change. Some things are very similar, but many things are quite different.
Gotcha, gotcha. And one of the trends we were going to talk about is that there's a 98% success rate reported with the scientific literature. And you know, like you said, a lot of things have gotten better. Some of the things have changed. What would you kind of attribute this growth and this success to?
I think the high success rates of modern dental implants is amazing, and it's especially amazing when you compare it to other procedures that are routinely done in dentistry and in medicine. The osseointegrated implants were launched in a controlled environment based upon documented research and academic education. It's continued to evolve mostly under that type of process, and key opinion leaders have embraced this approach. When you look at implants, are probably one of the top research topics in dentistry, not just in the U.S., but on a global scale. And the rapid advancements in science and in technology, it's really accelerated our field. And the high success rates are achieved when educated and experienced clinicians stay abreast of current literature and business practices.
So it's important. There's a lot of research. There's a lot of background out there. It's important for dentists who want to get more involved in implants to stay on top of that.
Absolutely. It's changing, and we need to be able to base the new advances with the standards that have been documented in the past, and then modulate between what is leading edge and what is current state of practice.
Gotcha. And one of the other topics that came out of some of our past features on implants was that 9 out of 10 dental professionals believe those who practice implant dentistry should really adhere to specific guidelines. And I know you've kind of touched on education a little bit, but why is this so important?
Well, observing guidelines contributes to implant success. And nobody wants to do a procedure where you don't have success. Failure is difficult for both our patients and for the dentist. That successful practitioners know that key opinion leaders and researchers, most of whom are members of the Academy of Osseointegration, have contributed to practice guidelines of various forms. And those guidelines are important, number one, because it protects the health and safety of our patients. They foster the best use of science and technology for the benefit of patients while minimizing the risk and adverse effects. Number two, I think clinicians need a reference to determine which cases they should treat and which cases they shouldn't. Sometimes referring to a more appropriate colleague is indicated, but I think all successful dental professionals know that observing guidelines will build their practices, build their reputation, and it's good for their patients and it's good for their businesses.
Gotcha. And so I think as you're getting more, as the practices are experiencing more success with implants, it really is a team. It's really a team involvement. It takes a lot of different parts to get everything just right.
Absolutely, and there's some cases where you may not be the best qualified person to perform that, and making the right choice of referring to another individual might be indicated. And it's not a reflection on the individual. It's just trying to do our best for our patients.
Gotcha. And why don't we'll shift gears a little bit to immediate load. I think there were some reports that maybe in 2014 as many as 15% of all the dental implant procedures in the United States were immediate load. Do you expect that number to increase? And why don't you just touch on that a little bit?
Well, I think immediate load is a very popular topic in implant dentistry right now. My personal opinion is that it's going to increase over time. I think part of that is due to the greater marketing and awareness that both patients and dentists are having on the benefits of immediate loading, and that the desires of patients to have an immediate, non-removable prosthesis at the time the implants are placed really will drive that initial increase. Many dentists are going to try to use this one aspect of implant dentistry to treat these patients. But the important part to remember is with immediate load, you need very specific circumstances for it to be successful. And this includes the right anatomy, biologic factors, and educated and experienced clinicians to provide that treatment. I think over time, that number will probably decrease. And that's because the number of patients suitable for immediate load cases at this time with this current level of technology, I think is less than what's being advertised. And it's important to remember that current implant guidelines are based on years of evidence-based research, and immediate loaded implants doesn't have that same background yet.
Gotcha. And so it's important to know that this isn't just right for every patient.
Absolutely. I think there are very specific indications to do immediate load. Those patients that we do it in, it works great, but not every patient is a candidate for immediate load.
Gotcha. And now just dentistry as a whole, I think about 1 in 10 dentists are placing dental implants. But we obviously, like everything else, we expect that area to grow. And so what are some, maybe 5 questions that you should be asking dentists to make sure they're qualified if they're going to start placing implants?
I think what's the education, training, and experience of the dentist providing those services? Where'd they gain that knowledge, the skill, the experiences? A great place where dentists gain that kind of training and be sure that they're at the forefront is who are members of the Academy of Osseointegration. If they've attended our annual meeting, they have global leaders in implant dentistry providing them lecture format education, hands-on courses, the opportunities to personally discuss treatments with them, learn those little differences that contribute to success. They also can go on our AO's website at www.osseo.org. There's an opportunity for continuing education for them through that, webinars, as well as web-based interactions that can really improve their background knowledge in dentistry and implants. And so I think patients need to ask them, where did they get the education, experience, and training? That's an important part. The other question I think patients should ask are there dentists that are more qualified to provide those services? Because informed consent is an important part of any dental treatment, and implants it's especially so. So, is their surgeon best qualified to provide that procedure for that individual patient? And I think it's important for patients to understand that if they are referred to another individual, that's not a negative reflection on their treating doctor, their dentist they always go to. It's more important to show that that person's a true professional because they're sending them to somebody who can do it better than they can, and they're protecting the health and safety of their patient.
Yeah, I think that's a critical point. You can have a dentist that you love and who's wonderful with a lot of what he's doing for you, but if he's got a difficult implant case, you'd rather go somewhere where maybe a more trained professional is going to do a spectacular job as opposed to your dentist trying to do something that maybe he's not totally cut out for.
And I think it's important to remember that as more and more dentists do implants, as they seek out ways to learn about implants, they're going to be able to do those type of cases, maybe not now, but in the future. So it's not something that's a stagnant process, that as they grow, they can do more complex cases, but to be, a little humble at the beginning, learn your field, and then grow with that. And I think that's an important part. As a past educator, you see that in your students, in your residents, and in new grads, that as they join organizations, get that experience, they really can become quite proficient at procedures and learn what you can do and what you can't do. And that's an important part of any practice.
And I'm sure that they would, dentists can enjoy being part of this rather exciting field. I mean, what the benefits of a well-done implant is just, they're just through the roof. And I think it just, as the awareness and as the patients are asking for this better care, it's just, I imagine it's probably a pretty exciting time for you to be involved in this field.
From day one, it's always been an exciting part to watch this grow, to watch the number of dentists. Initially it was only specialists that could even work with implants. Now general dentists are embraced in our field, and everybody enjoys working with the general dentist as well as with other specialists. It's knowing your limits, starting off easy, gaining experience in the education, and taking on harder cases. Implants are very rewarding, not just for the professionals, but for our patients. They build our practices. Successful patients go out and they tell other patients, and they tell other doctors about you, and that's how everybody grows in this process. And it's a benefit, tremendous benefit to patients and their treating dentist.
Yeah, and just imagine the satisfaction of taking a patient that maybe was having difficulty doing normal things, smiling, eating, and chewing properly, and now you've really kind of helped their lifestyle.
Absolutely, the quality of life. All the research that's been done on chewing efficiencies, patients' personal self-confidence. I think every dentist who does implant dentistry has seen their patients make miraculous transformations. People who wouldn't go out in public now go out in public. I think restaurants have been probably one of the biggest benefactors from implant dentistry. I mean, people go out in the public, they're enjoying their time, you know. So I think maybe we should consider that the self-confidence that people have is really, you can't put a price tag on that.
Sure, it sounds very rewarding, and let's just think. I think you've given us a lot of great stuff to think about here today, and I just want to let our audience know that they can go to your website for additional information. They can also go to dentalproductsreport.com. And thank you very much for your time today.
Well, thank you. And again, I'd like to remind people that if they want to go to our website, www.osseo.org, all that information is available.